So I am going to tell you a little bit about me, because I think one of the things that I also worked on for a while was really talking about loneliness, that we don't know each other, we don't talk to each other anymore. And that even COVID made that worse. And when you talk about mental health issues, we're not communicating with one another. And I could come up here and I could talk to you and you'll leave and you'll never know who the hell I am. But I want you to know who I am, and I also want you to know who all of you are. So I am Maddie Castillo, I'm the Commissioner of Health and Human Services. I have been in the city now for 9 years and some change. I am originally from Cuba. I came here when I was 7 years old. I came here in what was called Peter Pan expeditions. I don't know if any of you have ever heard of that, but like 4,000 kids left Cuba, and just the kids alone. We stayed in foster homes. I was supposed to stay in Miami, and they shipped me over to, actually it was supposed to be here in Boston, in Massachusetts, and my mother wrote letters saying that I was allergic to the cold and the down. Wow. And so I ended up, they sent me to California. So I grew up in California, went to med school in San Francisco, and then I met my husband in residency in St. Louis. And he wanted to come to New England for 2 years. That was 36 years ago. I still hate winters, but I live here. So I did my last year of residency here, and then I started practicing medicine, and I worked for Family Health. And then what I started to do on the side, because I wanted to know the community, and since I speak the language, I'm Latina, I wanted to meet the community. And so I met this gentleman named Hector Reyes. And why I tell you all these stories is because I want you also to know where I'm coming from, and the passion of things that I believe in and that I like working with. So I did these things on the side. So I met this man, Hector Reyes, who said there's a huge addiction problem. This was back in 2004. And it was also associated with some violence that they were noticing in the Maine South area. And he said, I've had a history of addiction, and I want to figure out how we can provide some treatment. And we go places for treatment, but they don't speak the language. I'm not used to eating mac and cheese and all this other kind of food, and we can't recover in that way. So I worked with him, and I've never done this before, but we decided to put a treatment facility for Latino men. It's on Vernon Street. And this is Hector Reyes. And so part of that program, and part of why a lot of the work that I do is also on addiction. One of the things we wanted to do was really to bring housing, and the two houses that are there, I can't point, can I? The yellow house and the other house are two transition houses, and the brown house that you can see on the right is the program. But the intention was to, how are people going to recover? Are people going to recover in an institution-like setting? We want to make it like a home setting. So this was some of the transition houses. So you go to the program. It was a 25-bed residential program where when they graduated the program, they went to transitional housing. If you know about sober houses now, if you try to get into a sober house, it's about $800 per person just to have the room. You share kitchens, you share bathrooms. If there's two of you living in one room, it's $1,600. So you think about somebody who's homeless, who's trying to recover from addiction, trying to go into a sober home. Who's going to afford that? And people can't afford that. This was a minimal money that you had to pay, and people went there. But then people can't pay for their rent overall, let's say, and they're not going to stay, can only stay in the transition houses for 2 years. So what do they know? What do we know about people who suffered with substance use in the 1970s? What happened in the 1970s? What do we do with people with substance use? What was the method of treatment? Anybody have an idea of what we did to people? What we did? What? Mental. Yes, and what was the mental institution that we talked about? Prison. So they were sent to prison. The majority of the people who went to prison were people who were black and brown. Why was that? So other people were able to do their cocaine or their drugs in their own house. Other people, they live in multi-generational families, like we've learned during COVID. They had to go step outside, and that's where they were doing drugs. And so people were incarcerated, and people spent years. If you were caught with drugs the first year, if you were caught with drugs, you spent 5 years in jail. The second time you got caught, you spent 10 years in jail. Third time you got caught, you spent 15 years in jail. So when people come out of jail, hard to find jobs, They have the quarries. And so how are we going to get people jobs? So one of the things that we did, and I don't know if it's here, I'll go back to this. But one of the things that we did, let me see if it's here. Yeah, I'll tell you about that. But anyway, one of the things that we did was we opened a cafe, which was Cafe Reyes. It's a job training program. This is all that we need for people with addiction. We need housing, we need job training to be able to get people back on their feet. People get back on their feet and they do really well, but we need to support people in that process. So I talk about this because this is the other thing that we face in the city, is we don't want it in our backyard. And one of the nice things for me was that a lot of my patients that I was seeing were actually living in the neighborhood, and so that was the first time that you'll see Latino Rehab Center greeted or welcomed into the neighborhood. You will never hear that. There's always a fight. But why is there always a fight? Why do you think there's always a fight? Fear. Fear, yeah. Stereotypes. And what neighborhoods do they tend to go to?
And it also, like the housing area, it brings the value of property down to rehab program.
Yes, but they go to one section of one parts of the community. What are those parts? Right? The four parts of the community, right? Do they go to the west side? No. Why is that? Because the zoning laws don't let that happen, right? So we have certain areas. So the neighborhood is trying to say, I don't want any more of this. We don't feel comfortable. We feel unsafe. Sound safe? Yes. And so we don't want it. And also they don't know you and they don't know what you're going to do. And that was the one positive thing, is that I knew the people and they knew that we would keep up the place and take care of the place. But those are the issues that we have when we try to cite housing. The other thing I talk about is that, and it sounds a little corny, but that's my house. This is the entire program coming to my house to celebrate holidays. What do I say by that? I'm saying that people need love. We were taught in med school, you don't get close to people. I don't get close to people, but I want to show people that I care about them. When you care about whoever is on the street, anybody, you show some attention to people, people respond. And what happens a lot of times is that doesn't happen. That people are, we walk past people, we cross the street if we see somebody who's homeless. People have developed that whole stigma that they feel that nobody cares about them. And the idea is to be able to really care about people. And I say that because those people are somebody's brother, somebody's sister, somebody's mother, somebody's father, somebody that needs that attention. So the other piece was that we went to Quinsigamond College and everybody learned a trade, which was to become prep chefs and how to run a restaurant. Then in 2015, I came to Health and Human Services, and these are the areas in the Department of Health and Human Service that I oversee. Some of the things that we work on in Health and Human Services, and I have to tell you, I am a doc. I don't have that really public health experience, but the public health experience came from putting a program together and figuring out what are the problems in the community, and we can do it. And you could learn how to do all this because I didn't have any of that, but we learned how to go through it. So I brought some of those things into the city of the things that I look at. And one of the things that we're doing, there's plenty. There's the Equity Task Force, which we started really was the COVID Equity Task Force. The COVID-19 Equity Task Force now is the Equity Task Force. And I'll talk to you a little bit more about what that means for us. We have the Mayor's Mental Health Task Force, where we look at mental health issues in the community, and I'll mention some of that. Reentry Task Force, what are we doing with people when they're coming out of jail? Housing First, to figure out how we do housing. The Opioid Task Force, looking at how all of us work together. I think that my job is convening the community and saying, how do we work together on some of these issues? And so we have all these different things, and I do a lot of education to medical students, to anybody who wants to listen to me, because that's the goal, is hopefully to get you guys to be a part of this process. One of the things that I've really been working on, and will be the first in the state to happen, I don't have all the partners that I want, is to actually have the medical school look at all the electronic medical records and give me the data. And so we've done some of that. I still have partners who are afraid to give me the data, or part of what's happening during COVID. What did we used to do during COVID? Probably most of you don't know, but that was like the best time. And I don't want anybody to die, I don't want anybody to get sick. But for somebody who's in medicine, to be able to work with people and try to help people, it was like the best time. And collaboration, I've never seen so many people work together. I wish it stayed the same, but that hasn't quite come together. We're back to being separated, so you have to do a lot of conversations to get people together. But we have this dashboard that we're still working with communities with the health centers and the hospitals. But this is a dashboard that we have, and we could look at anything we want to look at. And I'll tell you some of the data, what it tells us. But we look at the electronic medical records, and we're able to pull out data from UMass and from St. V's. No names, no nothing, just to see what the total amount of things are. Who's suffering the most, who's having the most issues are some of the things that we want to do. Public health works on data. We don't work on just a whim or whatever. If the data says that it indicates what the problems are, that's what we decide, that's what we work on. But we can't do it alone because public health has to educate community on what to do. One of the things we talk about, and I don't know if any of you have heard of it, have you heard of the social determinants of health? What's the social determinants of health, Mr. Waddell? What?
No, I just heard about it, but I want to talk.
You don't want to talk? Okay. So what's the social determinants of health?
Income?
Income, it's important, right? What else is important? So 20% of your health comes from going to see the doctor. What are the rest of the things that make life better for you? That gives you an extended life expectancy? Exercise. What else?
Food.
Huh?
Access to healthcare.
Somebody said food.
Food.
Healthcare only 20%. Environment, so the neighborhood, is there mold, is there lead in your building, or do you have trees that cover you during the heat and all that kind of stuff? What else? Poverty, right. So,
Livestock.
life sucks?
Livestock.
Right. What about all those other things like tobacco and alcohol and cigarettes? We all know that stuff is bad for us, but we still like it, right? Sugar, all those things that we shouldn't be eating. So how many of you are vegetarians here? Vegans?
Once in a while.
Once in a while. Right. So remember, only 20% is healthcare and the rest is what you do. And really where you live, access to transportation, where you work, those are all important. So I wanted just to tell you of where Worcester stands in a lot of ways. I mean, I'm looking at things like, how many people have gotten a high school degree? 85.7 have gotten a high school degree. 34.1 have gotten a bachelor's degree. High school, we're actually not that bad. We're 85.7% of people graduate from high school. We're a diverse community. We have people from all over the place. That is actually an asset to have that. I mean, to be able to share with people in your community who come from Ghana, from El Salvador, from Cuba, from all places, to hear what they're about is incredible. But yet we have issues, and we have issues in neighborhoods that have the most vulnerable people, and in particular that are people of color. And if you look at just some of the trends, what the and you will always see the same kind of trends. So if you talk about a Latino, median household income is $60,000, a black person, median income is $52,000, and white is $81,000. So this leaves communities of color behind. Poverty rate, you can look at it the same, 16% in the Latino community, 17% in the black community, 7.7. This is not just something that was just developed and it just happened. This is years of this coming about. Net worth. Have you ever seen the net worth of what people have? White's net worth. You know what net worth is? How much I have in the bank? $265,000 for the white community. Black community, $700,000. Look at the Dominican community, $0. Puerto Rican, $3,000. I mean, that's their net asset. Something's wrong with that picture. These are the things that we try to figure out what we do for neighborhoods and be able to assist them. Poverty, when we look at poverty, and what does poverty do? Poverty is just, somebody doesn't have enough money. Poverty affects every part of your being. you're not healthy anymore. You're not eating the right foods. So people who are living in poverty have risk of every disease entity. And look at children. When we were able to give, during COVID, that we had that the tax credit for youth, you can see that that line completely dropped, that we were able to get people out of poverty. When we stopped that after COVID, that went back up. The worst thing that we can have is childhood poverty. And then remember this picture, because this picture tells you the social vulnerability of our neighborhoods. The same dark lines, you see the dark green lines are socioeconomic, and you see the gold lines. Those are the same neighborhoods you will continue to see. These are the neighborhoods that are poor. These are the neighborhoods that speak a different language. These are the neighborhoods that have multi-generational housing. But I'm going to show you how all these neighborhoods are being affected. But first, and here's the start. And I always talk about this in reference to Cuba, because Cuba we left because of communism. We left because we weren't getting enough food. Sort of a little bit like what we're feeling now. I shouldn't say that. But that feeling that we think of now. So Cuba has a life expectancy of 78.5. Massachusetts does very well, life expectancy of 80.7. Look at Worcester, Maine South. 74 years is your life expectancy. Worcester Kelly Square, 72.9. Worcester Union Hill, 71.6. We need to change that. We need to change that and change the social determinants of health for people. So actually, it was better to live in Cuba than to live in Worcester, Maine South.
Yeah.
I mean,
So let's move.
let's move. Better climate. So I'm going to show you, I told you I was going to keep showing you the same map. This is Worcester all-cause mortality by district. Look at all the little dots, and you remember that map. It's the same map. The same socially vulnerable areas are the ones that are suffering the most. Again, look at where hazards are mostly in our community. Where do we find lead paint, mold, pollution, all of that, and those areas that are the red areas in that area, and the blues that are, but you see where they're all stuck together. Those are the same socially vulnerable areas. And you see at the bottom it talks about the Hispanic community and the black community, and you can see the same areas that we talked about in the map is where they're living. But that's where we see the issues, and how are we going to go and try to do that. When we look at the Worcester Public Schools, look at some of the schools and look at their asthma, the percentage of asthma in the public schools. Right, so what causes asthma? All the things, the pollution, the mold, the things that are in the air that are in particular areas of our community. Look at the percent. Nationally, the percent of kids who have asthma of that age group, of the ages 5 to 11, is 8 to 10%. But look at this numbers that happen here in our communities of color. You know what's happening with measles? Do you think we're doing okay with measles here? Here we're doing pretty good. We actually have a vaccination rate in the Worcester Public Schools of 95% or something like that. It is great, because you know it's not happening every place else, right? That's why we had the outbreak in Texas and the neighboring, yes. And so we don't want that to change. It started to change a little bit during COVID, where people weren't getting vaccinated. What happens when people don't get vaccinated and only a few get vaccinated? You remember in COVID, they had this thing called herd immunity. That if we all got vaccinated and one person walked in here, he would be protected because we're all vaccinated. And that's the goal. Don't let anybody tell you that vaccination doesn't work. Vaccination has at least left us all here. Vaccination is what keeps us alive. And so that's the important case, but we need to make sure that people are being vaccinated, and they continue to do that. What's the other one that's coming around? We always have to think about what's happening. So we talk about the avian flu, H5N1. That's the other one that people are talking about. We don't know what's going to happen with that. Right now it's not in humans, and the only humans that it's there is people who have been working with the animals, with poultry, or and it's transferred from poultry to different animals. But that's how COVID started, right? Mm-hmm. So we had, for us, we have to think about being prepared. We have to make sure that we have everything in order of how we're going to react when something happens. It may not be this, who knows? But I want you to know that climate change does do a lot of change to our society. Things transform, things mutate, and so we don't know. But we always have to be prepared, and that's the biggest thing that we can do and that you need to do also. Just to be aware and let people know when you see a dead bird. Call Rob Antonelli and let him know wherever he went. And let him know so that we know that we're seeing it. So back to COVID. Most of the people that, actually the majority of people who died from COVID, the highest percentage was black. Latinos, blacks had the highest positivity of COVID, the less being tested for COVID. And why was that? Why was that? Is that because they don't care and they didn't do anything? Why did we see those numbers?
Accessibility.
What?
Accessibility to probably healthcare doctors.
And their job.
Frontline workers.
So you know, I'm pretty privileged. I lived in Holden. I had a house on a farm. And yes, I went out and did crazy stuff here with COVID, but then when I went home, I could sit outside. I didn't live with anybody. It was my husband and I. Remember I told you about those multi-generational buildings that people live in? Mom, grandmother, kids, everybody lives together. So they're passing it on to one another. You know, what we did during COVID was we separated all the homeless people and put them all the different schools, all the gyms in the schools, because we didn't want them to be together. And yet we have people who live together, and they pass it on from one to the other. So what do we do? How is the best method to really go out into the community and to change the things that are happening? People are working. I mean, you all work. You know that sometimes it's difficult to get to the doctor's appointment or do the things that you want to do. That's how people who are working 2-3 jobs a day feel like. So what do? We went there. So we put vaccinations wherever people were, in markets, in their cars, wherever people were, they were getting a haircut, whatever it was, we were giving people vaccinations on the street. So I told you I was going to look a little bit on about disparities and what are some of the inequities that we look at, and that's part of why data is important for us. A lot of what I also want you to know is that if you compare a black woman who has, or you can compare me, I'm Latina, I got a medical degree, I went through all the schooling, I'm actually financially pretty decent, and you compare me to somebody else who is poor, doesn't have any education. When we go deliver a baby, for example, who do you think has the worst outcome? If the scenario is a black woman, the black woman. If the scenario is, but which black woman? Is the poor? No, it's equivalent. It doesn't matter. It doesn't matter what your income is. It doesn't matter what your education is. Why is that? Racism. What does racism mean to people? I mean, I can tell you what it means in a sense to me and what it feels like, right? It's a thing hanging on your shoulders whatever you do. You're constantly feeling stressed. For me, you're not good enough. You're never going to make it. Oh, you're the example. You have to do it. So you're constantly feeling stressed. Doesn't matter if you make it or you don't make it. That thing on your shoulder that you feel, that people feel differently about you, you carry that for the rest of your life. And what does stress do to people? Is it good for your health? No. It does terrible things to your health. So actually, both of my babies were premature babies. I'm a doc. My husband's OBGYN. I had 2 premature babies. So that's what ended up happening. And in our country, the national maternal mortality rate, so Massachusetts is, as most of you have seen, we're number 1, number 2 in the country in healthcare. Yet when we look at maternal mortality, and again, the people who suffer the most are black women, we rank number 8. So we have 16.4 live births is the problem, but we rank number 8. If we look at morbidity, that means complications after they delivered, whether it's depression, whether it's bleeding. Massachusetts, remember, number 1, number 2 in the country as the healthiest country. Remember, we could be the healthiest countries, but remember those areas that had the lower life expectancy. We're number 45 in maternal morbidity in Massachusetts. Ooh, what happened to that one? This one was supposed to be the rates of infant mortality. And again, I don't know what happened to the slide. Oh, there it is. I gotta press the next button. Same thing happens when we look at infant mortality. The purple is the black women, black babies in Worcester. The red is Latino, and the white is the blue. So, and in here, you will continue to see the disparities as we go along. Prostate cancer, the incidence in black men in the United States is 60% higher, and mortality is more than double the rate observed in white men. That black and Latinos have a higher prevalence of diabetes and hypertension compared to other races and ethnicities. That black and Latinos have significantly higher ED visits for diabetes and asthma. And why do we have a lot of why do they go to the ER a lot? They don't have health care. And so that access to health care, or they can't make it to health care, or they can't afford it to health care. What's one of the highest cost premiums of health care in the country? Who has it? We're number 2 of highest health care cost in the country. What's the longest waiting time in an emergency room?
2 hours.
We have the longest wait time, but how many hours do you think most people wait? You could, the longest is that, but the average of 3 to 4 hours.
When you say we, in Massachusetts? Or
In Massachusetts. Yeah. Yeah, we're one of them at the hospital. What do we lack most of all? I'll get there. Hold on. I like to ask questions. We do the same for breast cancer. The rate of new cancers, look at, and certainly the white is there. Look at the black, the numbers in the black community. White women have the highest rate of breast cancer, and black women have the highest death mortality from breast cancer. And then we talk a little bit about, how we eat and what we need to do regarding eating. And sometimes we need to teach people how to eat with the food that they're used to eating. So if I'm Cuban, I'm not going to eat, well, now I do because I'm old and I want to do that. But you couldn't tell me back in the days when I was younger that I was going to have tofu. But you can make, if you go actually the whatever the marketplace that's they sell food there, you can actually now buy vegan picadillo. So the point of that is to say that you can make all these foods that we eat. You just need to learn how to make them appropriately. That we're not going to use lard, that we're going to use the appropriate oils when we do that. That we're not going to start eating bags of potato chips and sugar with everything that we do, that we're going to cut down on our sugars, that we're going to eat whole grains instead of white bread. We have to bring that out into the community because we need to live a lot longer. When we talk about obesity in Worcester, who has the highest rates? You can actually just, I don't need to say it anymore. Black and Latinos have the highest rates of obesity. And why is that sometimes? Look at Worcester overall, the percentage of adults that have reporting no leisure time. So in both Massachusetts and in Worcester, the blue line on top is the self-reported physical inactivity. So we're one of the highest in Worcester that we don't do anything. About 31 million adults 50 years or older in the U.S. are inactive. Wow. They don't have exercise. How many of you actually go out and do some exercise every day? Every day. There you go. Every day. I don't care what it is. Go walk a little bit. Whatever it is, build. It's important to be able to do that. So diabetes, obesity goes hand in hand with diabetes. Look at the rates again of who's, and interesting, the Asian community. But again, the black community is there, Latino community isn't far behind. So I was talking about primary care. Do we have enough primary care in the country? No. Do we have primary care in Massachusetts? No, we don't. Why is that? Why is that? Does anybody know why we don't have primary care?
It pays less.
It pays less. And they make us work like dogs, and we have a million pounds of paperwork. And they say that we're not, the surgeons make much more money than we do. Any other specialty makes more money. And so UMass, that was the person, the hospital that really brought in people to do primary care, they're not going there anymore. I used to train them all. We used to go through, I still do, but we used to go through the community and learn the community. Who was coming? Neurologists, all different kinds of groups were coming to learn what's happening in the community. I said, what happened to the primary care? There's no primary care. And so we need to rebuild primary care, and we need to pay them what they deserve, because that's your front line to be able to do the work. And people, if they don't go to primary care, where do they go? They go to the emergency room. And yet that is not appropriate care. You'll see a different person every day. Who's sitting most of those 18 hours in the hospital, in the emergency room? 18, 20 hours. What diagnosis do you think sits the longest in a waiting room?
If you're not dying, they'll make you sit there forever.
Forever. But there's one group of people,
Chronic disease.
well, you can call it chronic disease, but it's behavioral health. Like people with mental health issues. And why is that? What do we do with people with mental health issues?
Well, there's no more institutions.
No more beds.
Nothing,
There's
yes.
nothing.
And we cut down all our beds in hospitals. And then we privatize some of that stuff.
Yeah.
So we don't have those beds. So if you want to send somebody for behavioral health, they're going to be boarding there for God knows how long. Second highest family insurance premiums in the United States. The average premium of health that you're paying for insurance is $29,000 a year. Okay, then you go to my topic of addiction, and I know probably where is Liana's going to tell me to. How am I doing?
You're doing great.
Oh, good. Okay, so what causes addiction? Did somebody just decide I want to use drugs? What caused it? How did that start? Because we blame the people who started using drugs because they did it to themselves. They should have picked themselves up by the bootstraps and fixed it. Where does it start?
Mental health, it starts with mental health and the environment and people you are around.
So how old are you when you start using drugs?
My sister started when she was about 15, and it was delirium rate. It was all the mental stuff that was going on. And it just got worse and worse and worse.
So the average age is 13 years old.
Really?
So people, it's not that I decided to, anybody decides to say I'm going to use drugs. So at 13 years old, what are they using? They're using alcohol, they're using cigarettes, they're using marijuana. Why are they using that? You said something.
It's a way of a de-stressor, like.
Right. Why does a 13-year-old need something to de-stress?
Because they don't want to think about what they're dealing with.
Trauma. They don't have other coping.
Right.
I mean, I know why she started.
Huh?
I mean, I know why she started.
Yeah.
I don't know why she.
And what are some of the adverse childhood experiences that people have, the trauma that we talk about? You know, people getting divorced. We think it's simple things, people getting divorced, child abuse. All these things are the ones those are the trauma things that get people in that position. So it's not a 20-year-old, very few, who start at that time. What happens to your brain when you're using drugs?
It starts to fry.
It starts to fry, that's a good way to say it. When you're 13 years old, that's when you're connecting, all your nerves are connecting, that's when you're building that system, and you're not letting that system build.
Yeah.
So that impulsivity that we see in kids sometimes, and if you don't, by 25, they're doing better.
Yeah.
But you don't even get to see them at 25
Yeah.
because they've been using drugs that whole time.
It's very sad, so.
One of the other things that you don't hear a lot about is suicide. A lot of kids are depressed. For me, my personal experience, today makes it 7 years since my son, he was 17 at the time and committed suicide. Because of depression, I didn't see it. I didn't believe it. I didn't know it. So that's another big thing.
Absolutely, and I'm going to talk about it because that number has even increased more during COVID.
Yeah.
That people are thinking about suicidal ideation and that people are going through suicidal attempts. So mental health is huge for us. What are we doing? How do we do this? It's been tough enough to get an appointment to see somebody, but then it's once and then it's a month later. Is that enough? What are we doing? That's the other piece. So anyway, ACEs are the causes of substance use. I just want to tell you a little bit because, again, what happens to people with substance use? So what happens to me when I eat good? So I always say that people have a dopamine level of 100. That's normal. You get out of bed, you're doing well. 150 is what I do. I spend all day long eating at work. Because I die out doing it, and I candy. She's always, where is Eliana who's always giving me candy? Candy. And I just told you not to eat sugar. But yes, I eat it. I'm sorry. I have to say that I do eat sugar because it gives me that high. I feel better. I can work another hour. Then I drop, and then I can eat some more, and I work, and I keep working. And it's funny because I haven't eaten yet, but I do. So everything else, look at sex. It increases your dopamine to 200, cocaine to 350, opiates to 500, heroin to 900.
Wow.
I can't even imagine. Think about meth. How do you feel? I know I feel great when I eat something. If I eat something sweet, I feel great, and that's only 150. So I can't even imagine what that feeling must be like, but it's a good feeling. Exercise does it too, but it isn't there.
What is exercise?
Exercise is probably the same as food. It gets you that feeling of high. I go to gym in the morning and I feel like I want to just be in bed, but once I start working out, I feel great. And then I go to work. So when people eat food, you know, we say with the baseline, normally we're 100 of dopamine. We eat food and we return back to 100 afterwards. That's that high feeling that I get when I eat something, and then I'm back to normal so I can eat again, and we constantly keep doing that. What happens with people who use drugs, the first couple of times that they're doing it, you'll see that same spike and they go up and they'll be back to normal. After you're using for a while, you will never feel that normal again. You're down at the new baseline, which remember, we're normally feeling good. I get out of bed at 100. These guys are way below the 100. So they have to keep using the drug to feel better. When they go to the ER, what happens to them? Let's say they had an overdose and somebody gave them Narcan. What happens to them? What do they want to do?
A new baseline?
They want to use again because they want to feel better. Just no different than you and I when we're stuck in bed and we feel awful and we have a fever and we can't get out of bed. Let's take this, anything to make me feel better. That's all they can think about is how do I get to start feeling normal? If your new baseline is below 100, you're feeling miserable. So your first thing you want to do is to start using drugs. And so what do we do for people like that? We decide that, you know, we've had methadone for years, but people say don't use methadone because, you know, as you're replacing one for the other. We have drugs like Suboxone. Don't start using that. No, start using that because that is what's going to help you feel better. That stimulates the dopamine secretion, and people can start feeling better. Medication like no other medication. We take, for a diabetic, we take insulin. Does anybody say, why are you taking insulin? You're replacing one for the other because your body needs it. And so there are medications, but there's a stigma around medications. We're beginning to use more, but there's still a stigma around medication. This is part of the disparities in incarceration, but I won't go there. I wanted just to show you the same slide of people when they get out of jail. Where do they go? They go to the exact same neighborhoods that we talked about, the most socially vulnerable areas. The new thing now, which is actually really cool, and I wish I would have known it when my kids were young, was called positive childhood experiences. It's like you don't tell your kid, hey, you know, you're gaining weight, your hair doesn't look as good as it should, why don't you go home? These are things when I grew up with, my parents, my mom in particular, would tell me. Well, those are the things that leave some stuff on you. But instead, what are the things that we say to kids in a better way? And I saw this guy, they had him on the news, who was delivering babies, and he would grab the baby. I don't know if you guys ever saw this on the news. He grabbed the baby and he said, you know, you are wonderful. You're going to be great in this world. I'm looking forward to seeing you when you're going to be great. And that's just an example of what we need to tell our kids, so that we build their self-esteem and who they are. So there's a whole thing in the Department of Public Health trying to teach people about the positive effects of what we do. These are some of the things that we do in the community, that we bring a methadone ban, we bring the Spectrum van, the Spectrum van who brings methadone, Road to Care, who brings Suboxone into the neighborhoods, to provide medication treatment. And you can see the numbers of where we are. The latest data that we still have, we don't have 2024 yet, but we took the first dip. Why do you think we're taking a dip in, why is our overdose numbers going down? What's in the community to help the overdose numbers? What do you think? What medicine do we have to help people when they overdose? Narcan. And what did we do with Narcan? How many can carry Narcan? How many of you know CPR? why is Narcan different than CPR?
Right.
Right? So, everybody should carry it, because you will find people that you may save their lives. Narcan is a method of saving somebody's life, but people are afraid still to use it, but it's simple, and you can save somebody's life for that. So, it's great. We're not letting people die. We're bringing those numbers down. We still haven't figured out all the things that we need to do for addiction. But that's a piece, yes.
Where would you get Narcan?
You can get some Narcan from my office. I'm in room 101. Come by and visit me, and I'll give you some Narcan. I should have brought some here, but I didn't. But 101 City Hall.
Okay.
Yep. So again, Black communities of color have the highest numbers, and certainly Indian community, American Indian community has the highest numbers. We'll see it in everything that we do. A Black community still has, whether it's males, whether it's females, we have the highest numbers. This is some of the data that I look at, just what's happening in Worcester. This is police data. And you can see the numbers from 2016 and the drop that we started to have from 2023 to 2024. We're seeing a little bit of a rise now, but hopefully it'll even out. And sometimes when we see a rise is that there's a new drug out. There's a new drug out now called metomedine. It is, you've heard of, what are the drugs that are out there for addiction? Fentanyl. Fentanyl is it's like 100 times stronger than any opioid that you'll find. What else is out in the community? Crack. What else?
Heat.
I didn't hear.
Heat.
Heat?
Ecstasy.
Oh, ecstasy. Yeah, okay, ecstasy, all right. What?
The cocaine, but now it's the pink cocaine that's come out, kind of like a new mixture.
So it's mixed with everything. So you don't find one of everything. There's a drug called xylazine, which is like a sedative that people will, it'll last in your system, it'll slow down your respirations. It's mixed with the fentanyl. Now this metomedine is stronger than xylazine. So it'll sedate you even more. People are making these medicines. They're not medicines, these drugs. And so it's more and more complicated to get people off of them. So these are just the numbers from our police. I want you to tell me why, if you look at every country in the world, so the U.S. has the highest mortality rate. Look at every country, Norway, Sweden, every other country, and look where the United States stands in comparison with the rest of the world. So why do we have that? Do we have higher mental health problems?
We don't have national health.
You know why I'm in favor of national health, but I hear now that Britain and every place else is thinking about that. The wait times are still longer. We need to fix what we have here. We need to get rid of the for-profits, and they should be non-profit. That healthcare should not be a for-profit. So this is shameful for us.
So why
Yep.
is that?
Because Americans are messed up and don't deal with anything, and they're always trying to.
Well, what do we're individual people. We don't tend to hang out with other people, very rarely, right? We don't have that family background, that we hang out together. There's a lot of things in our character that makes us different than other communities. Some
of this is caused though also by the same prescriptions that are given to a lot of these people, like the elderly. You find that they don't get that, they need that high, so the numbers will
go.
up.
I would say that there's a much more established distribution network in the United States for the distribution of illicit drugs than you would find in Europe,
Yeah.
right? And
What
that-
is Europe? What else does Europe have that we don't have?
Uh,
Something that we've been trying to push
Universal
here.
health care.
Huh?
Universal health care.
Yes, but there
That's
So,
the
huh?
symptom.
Gun
not-
control, legalization of drugs.
Overdose prevention centers. So they have places where somebody can go and use drugs, and every place in, whether it's Portugal, Spain, wherever it is, and they have it. Nobody's ever died. Now I think one
They have those
person
in
has died.
San Francisco, I think.
No, nope. Only New York has them, and Rhode Island just opened up one. And we were trying to do it here, and it didn't happen. Again, just a little bit about NICOM. And I'm going to tell you a little bit, unless you can tell me when to stop whenever you want to, because I can go on for hours. But I wanted to tell you a little bit about youth mental health. Again, who's having the mental, who's feeling hopeless. So this is a risk survey that we do in the public health division of public health, and they ask kids these questions. So how many people feel sad and hopeless? And you can see that everybody's feeling sad and hopeless. But look at also communities of color where they're feeling. This is one that how many have seriously considered attempting suicide?
Wow.
And look at those numbers. And so I don't want to rush through that one, but that's it's the same thing as considered attempting suicide, and you will see that it actually following through with suicide. So we do have a huge mental health issue in our community, and again, I'm sorry for that. But we also don't know how to ask the right questions, and that's why in some ways we as a community, you know, when I go to work, I see people and they say, hey, how you doing? And I said, not so good. He goes, well, have a nice day. Like, we don't ask, like, what is it? Why are you not feeling well? We're not even listening. It's just like a ritual that we say that, but nobody says to me, how you feeling? And I'm not feeling that great. Okay, keep moving. So where are we having those conversations as families and as friends, as in a community, to say, how do you feel? So there is mental health first aid that community can learn. And there are different agencies that give it for free, just to even be able to ask those questions and be able to receive what somebody may tell you. These are just some of the things, again, when we talk about discipline in the school systems, and who a lot of times people don't know how to deal with certain people, and so if you see that, the black, actually the Latino has the highest numbers of expulsions, and black and Latino communities make up 30% of Worcester's total population, but 53% of DCF under 18. So this is also sad. And with respect to Department of Children. And so the same things kind of happen. You know, we talked a little bit about youth using drugs and vaping. Yes, sir.
I wanted to see this slide just before this one, and I had a question.
Please. Mm-hmm.
Why is it so low among the Asian? Is there any reason?
I don't know the reason. I know that sometimes, who knows all the different things that people react to. I mean, some people get to learn to go to preschool and they learn how, behavior at an earlier age, and some don't. And when they don't, do people know how to deal with their behavior? I'll give you an example. My kid was dancing on tables, and he was considered to have problems if he was dancing on tables, and that was my way of my kid acting out. And I moved him from the schools because they developed that perception of my kid, and he was labeled as that, and it's tough to get out of that label of when they think of that. And this is little kids. How do we deal with kids? He wasn't, he was an elementary school kid. And so it took a while to get him back to where he was. He's actually a researcher now. So we can help kids, and that's where also that positive piece, working with kids and being a part of the kid's life, is incredibly important.
So I was thinking that you said that different cultural background, a bit different races. I would think that maybe culture has a role to play in that.
Maybe what?
Maybe culture.
Oh, absolutely. Absolutely culture has a lot.
Racism?
Right?
Racism.
Yes.
A big part.
Yes. Yes, absolutely. The African community that has come here is very different than the black community that's been here for generations, right? They've experienced a whole different set of racism, all kinds of stuff, which has made it difficult. I mean, when were they able to go to college? When were they able to do all the stuff that we were able to do? Sir, you.
For what you just brought up, I'm curious, is that, as we look at the races, they are black, that includes individuals born here as well as immigrants, or is that parsed out to just African Americans?
It's just, that's how it's parsed out.
It's just African Americans?
No, it's black.
Okay, so that includes all.
Right.
I was just curious.
Anyway, so youth certainly are vaping, they're vaping less. Again, this is their opinion, that they're vaping less, they're drinking less, and they're using marijuana less. I still have some doubts about that. But I want to tell you about marijuana for kids that we're seeing a lot of, is that kids are using some type of marijuana that is also laced with fentanyl, and we've seen overdoses with that. So I worry about the whole marijuana thing, and people, and the perception that marijuana is safe, that marijuana causes no problems. Marijuana causes psychosis, paranoia, it causes lots of problems, but youth believe that it's okay, and then they're lacing it because they're buying it on the streets. I know I'm supposed to get out of here, but I want to tell you about our biggest problem, and probably I'll just tell you that right there. Our biggest problem is homelessness. No, I shouldn't say our biggest problem. We have lots of problems. Homelessness is huge for us. That homeless numbers have, if you can see the slide, has continued to increase. We don't have housing. We kind of stopped developing housing in the 70s, and now it's incredibly difficult. We have projects. Projects won't come up for years to come. In 2017, we said we needed 103 units of housing, and it's 2025, and we developed only 40 units of those housing. I think that the issue with homelessness, besides whether it be addiction, whether it's mental health issues, we have people who come to us that were living in an apartment and were paying X amount of money for rent, and they were living there for a couple of months, and the landlord says, I need you to go, I'll give you $1,000 if you move. And they're like, but you need to go. And they'll give them money to move, and then what do they do with that apartment? They increase the rates on that apartment. Our percent of availability of apartments in the city of Worcester is one of the highest in the country. 2% availability of apartments in Worcester.
Wow.
Yeah, you can't find an apartment. And if you find an apartment, it's incredible.
And it's gone, and they're upping, as you look at it.
As you look at it,
If you don't take it now, somebody else will take it higher.
Right.
Like, it's crazy.
Right. So I'll just, those are the numbers. We have people who do outreach in the community. These are the numbers. So in the winter, you'll see people in the shelters. Not all the shelters. We have a problem. We only have one shelter. And that shelter was built for 25 people. They increased it to 50 people. They increased it to 75 people. How many people do you think they had in the shelter? Rob Antonelli knows that because I told him. How many people in the shelter?
175.
175 people in the shelter. At 60 at the RMV, 175 at the at SMOG. The numbers are increasing because we have no place. We have a backlog. We don't have place for people to be. And I'll tell you a little bit more that chronically homeless people, let me see if I have the whole definition. Chronically homeless people are the people who have permanent supportive housing. I just want you to learn that piece because we talk a lot about it. But to be chronically homeless, you have to have been homeless for at least 12 months or on at least 4 separate occasions in the last 3 years, as long as the combined occasions equal at least 12 months. So those people who get a voucher that they can get an apartment, look how long you have to be homeless to get that voucher. If you don't have that voucher, then you have to then you're looking for an apartment. And yes, we have rental assistance for people, but only rental assistance for a few months. It is not the $1,200 or the $2,000 that you pay for rent. So people can get a little bit of rental assistance, and then what happens? Right, they can't pay it. They can't pay it, and our numbers are increasing because that's part of the problem. And it's happening to families, it's happening to kids. I mean, the kids, kids are with them.
So if I'm
and
understanding correct,
yes, sir.
some of the social systems that are set up to help support this exacerbate the problem?
We are social systems to help people. So you put somebody with addiction into an apartment, and then you go visit them once a week. What happens to that person? If you don't provide strong, supportive services, you lost it all. You lost it all. Because all you need is somebody to think for a little bit, I'm not feeling well, somebody passed away in my family, that's it, they're going to be like. It has to be strong, supportive services, and they're not paying the dollars for people to be able to do that. But we need those services to be able to do that. and that's part of the problem. So the other groups, so you see that all the groups have increasing number of homelessness. The elder group, my group, those numbers are increasing. So think about somebody who's 65 and above. But when you're talking about somebody who's been homeless for a while, for a homeless person, they have chronic illnesses, they don't have the ability to take care. So a homeless person isn't a senior like me. A homeless person starts at 55 behaving like a senior, because years without being treated, no medications, no behavioral health, all of that adds up. And so from 55 on, we have people on the streets, and that we need to figure out how we do all of this.
I have a question. Back on the slide 67, chronically homeless and the identification, who identifies that? Who makes that?
It has to be documented. Yes, CMHA, and you have to document it. It's incredibly important. She's pushing her. It's incredibly important. That's another issue. It has to be documented. So whether they went to the hospital and they saw somebody and that documented, but somebody has to document it each time that they were homeless, which is another issue. How do you do that?
Yeah.
But-
when you're
but-
homeless and you're
but-
not getting those services.
Right.
And you can't prove that you've been homeless.
Right. Evictions are a big problem. I'm going. Rent is up.
Let's see if we can give room for like 3 questions.
Okay, 3 questions. Let me just see if there's anything. Oh, look, I finished.
Yeah, okay, she'll let us ask. Yeah.
I just want to tell you that one of the things that we need to do to change what happens in the community is we can't sit behind a desk. We have to go out into the community and talk to people and bring materials to people, bring docs to people, because we have to be doing things differently to change what our system looks like. So docs have to come out. They'll still bill, they'll still get paid, but they have to come to the neighborhood. Instead of having us to come to them, they need to come to the neighborhood. They need to be able to do that. So I will ask the question, but I wanted to give you one little example that, again, I tell you that I'm privileged and that I work and I should know better, but I don't have time to make an appointment. And I had this nurse from whatever the insurance I have who said, I'm coming to your house. And she came to the house. I was like, wow. I said, wow, I should have this? But she made all my appointments. You ever stay on the phone for hours trying to make something, or months away and then something else comes up? Why don't we do that in the communities and get them the appointment, or bring the docs with us? That's how we'll change inequities, and that's how public health will also change inequities. And I'll stop there. Yes?
Hold on, I'm hoping to use the microphone, just for the fact that we're recording. If you'll indulge me, just bear with me. Ugh. Thank you.
Thank you. Lots of really eye-opening stats that you've shared with us. And you are clearly, managing the department that's got a very broad portfolio of challenges to address. So I'm curious to understand, what has been the trend line for your department from a budgetary perspective over, let's say, the last 5 years, as well as, the corresponding trend line as it relates to staffing?
I think the only way I can describe it is we're a small and mighty group.
What does that mean specifically?
It means that, I think for the Department of Public Health, they probably have around 30-something people. Boston has thousands. I think we have a maternal, we just opened an office of maternal health, and I called Boston to see, what they're doing and what their things are. They have over thousands of people just in maternal health. Just that, staff. They have more staff than I can imagine.
Are they getting a disproportionate amount of funding from the state versus Worcester?
Yes.
Yeah.
Boston gets much more.
But like on a per capita basis?
Yes.
Yeah. So I mean, there's something wrong with how we're being represented in the state legislature,
And on that note, I hate to interrupt, but I do just want to be mindful of the fact that I said 3 questions, and I'm trying to prioritize folks who did not ask questions last time. Please be cognizant of the fact that the survey that you will receive in about 2 hours, we'll have a question about what question do you wish you had asked.
So my name is Trini. I have 2 kids of my own, a 19 and 12-year-old, and I also work in the school department in UAB. Now, I have a question for you. We live in a world of, I don't go on social media, I think it's just really, social media to me, it should be information shared, private information is shared. But we live in a world where we're not, how do we bridge the bridge the gap connection for social relations within our youth? Because I really think that's a big issue, because that's why they lead into mental health. We don't practice that skill, even in our adult of social relations. We don't have that. How do we bridge that gap within our community? Think about what you did when you were a kid.
You went outside to
Right.
play.
We played house.
Right.
Right.
You played
We don't
outside.
have that. Right. So the technology is great and all, but as
That's
a society, how do we?
You've got to limit those things. You've got to limit.
I know there's a lot of factors, but.
Yeah, I think we need more places for kids to go.
Right.
That's important. I mean, how often do you have after-school programs in school?
Yes, I always try to tell my kids, like, be active, be active, be proactive, in order to, not just strive anything, be proactive,
They need an incredible social interaction, and that's also part of family. Do things with other families together. I mean, I think about when
In
I.
school level standpoint. how
In
do you
school,
do that?
that's right. But I think it's still the guidance of being able to do it after school, to be able to do it on weekends with the family. I think about, when I was a kid, that my parents was a group of us that went out together, all the friends knew one another. We hung out
And I
together.
feel like you say at work, like for instance, how are you doing? Oh, it's just like a ritual, like, oh, you're not supposed to say how you doing, or how you, like, no follow-up questions. Really?
And I can't touch you, I can't touch you, they don't let me touch you, but you know what? I get to hug to somebody and say, hey, how you doing?
Exactly. Or like, have a good day, happy Friday. It's as simple as that.
And that's what we all have to do.
Exactly. So I just want to know how do we
I
bridge
don't
that?
know, that's what we're trying to do, and that's why by telling you how important that is, not only for your kids, for us. And when we feel good, we're gonna give that to our kids. But if
But
we're
it's not
feeling,
like us though, we have to set the example for our kids. And I have to say, as an adult, I feel like we're not doing that. We preach, but we don't practice.
Right.
Think we love to preach, but I don't see the practice.
I agree with you.
And that's to me, in my opinion, that's real adult.
Yes, I do. I wholeheartedly agree. And that's it, in England, they have a minister of loneliness. And we say loneliness because we hang out by ourselves. And I forget the name of our previous Surgeon General. Vivic Martin. That was his thing, it was loneliness. If we change that, if we actually communicate with one another, our health would be better. Everything would be better, but we don't. And what do we do with our older people? We put them, Worcester housing, wherever, I don't want that to happen to me. So don't let that happen to me. But that's what we do with older people. Our kids move away. In those days, the kids never moved away. They stayed with us. Mine live in New Jersey and Michigan. I don't have kids, so I worry what will happen to me when I.
But that's not the problem, I see it.
No, but we have to, if we don't start here and saying, I'm going to connect with one of you, how is it going to happen?
Correct.
And we have to continue having those conversations about our connection.
And we start pointing fingers, and who cares how the problem started? Let's fix the problem, not worry about how the problem started.
There's your person for legislature, right there, sir. She'll fix it.
All right, last question. Someone who hopefully,
Thank you. I got somebody who'll take care of it.
someone who did not raise their hand last time, did not get the chance to ask a question, will be prioritized. Okay, frequent flyers, go ahead.
So question about our unhoused citizens in the city. How is that, our unhoused citizens in the city, how is that counted, and to what degree is that accurate in the sense, is it undercounted, or are there gaps in the numbers?
Yeah, it's not exactly. We have a COC, the Central Mass Housing, records all the people. So when we do outreach in the community, for example, and my staff goes in, they input into the system who they're seeing and who is following. And in the system, it says, Evis, who's one of our staff, is following this person, that person. It's put into the system, and that's how we count it. some of the methods that they have is sort of predicting, because you saw the numbers of, and they're not bad at that prediction. It's not quite science, but it is predicting that the numbers are there. So there are people who we may not even know. You know, once a year, HUD does the point-in-time count, right? So we get a group of people and we go out and we start counting people, whether they're in hallways, you know, in alleys, wherever they are, we count them. Do you think we can count them all? No, it's just, it's an estimate of what we think it is. And certainly there's much more than that. And so it's even more worse.
Thank you.
Everyone, please give Dr. Castillo. Thank you. I just want to tell you a quick anecdote about my friend Dr. Castillo. Dr. Castillo knows this. I really, really look up to Dr. Castillo. And I mean, someone asked me, who is she? And I said, she doesn't really need an introduction. This is a 76-slide presentation, and I called Dr. Castillo and I said, if I give you a minute per slide, you're still going to be over time. And she was like, just trust me. And she went through and started to model what the presentation would look like, and I put my hands up and I said, I'm sorry, I love you, I was wrong, you were right. So thank you again for coming in. I am super excited to introduce our next speaker. His name is Dr. Joe Robinson. He is the Director of Veteran Services. It falls under Health and Human Services. And he's going to be talking about his department. Just want to make sure that, I know we've got a couple of new folks. So the ideal layout for this is, I know Dr. Robinson's going to do a town hall style. For folks who have like a slideshow presentation, the goal is to do like a lecture type deal and then have time for questions. Every presenter has been tasked with designing a lecture that is interactive in their own way. So every lecture is going to look different. But if you see a slideshow presentation and they don't say, feel free to stop me and ask questions, just make sure that you hold on to them. That would be super duper. Without further ado, Dr. Robinson.
Good evening. How's everybody doing this evening? I'm Dr. Joe Robinson, Director of Veteran Services for the City of Worcester. You probably can tell I get told often when I speak that I don't sound like a Bostonian or East Coast person, so I'm actually from the Midwest. I moved out to Worcester about 8 years ago. Retired Marine, disabled veteran myself. And when I moved out, I fell in love with the city. I thought it was just beautiful coming from Iowa, the Midwest. And I was so impressed by the number of schools here. I was so impressed by the people that I seen just kind of busy, just going and going. And ironically, I remember calling my mother after my first week here. And I said, Mom, my neck is hurting. And she was like, why? I said, because every time I walk by someone, I keep trying to say hi, and I'm turning my neck, and I literally had a crook in my neck from trying to say hi to everyone. But everyone just kind of ignored me and minded me. And so, to be honest, I thought you guys were just so rude. I was calling my mom, and I was like, they are not Iowa nice. And, I just thought everyone was so rude. And then I quickly learned that you folks speak your mind out here. You know, so that took some getting used to. I was talking with a friend, and he kept saying, yeah, in the middle of me talking. So where I come from, I'm like, does he want me to hurry up and shut up? You know, and he just kept saying, yeah. And I was like, dude, I gotta ask you, why do you keep saying that? And he was like, oh, I'm just recognizing that I'm listening to you. So it was literally like learning a foreign language to my ears coming out. You know, and I had to get used to that. We were taught that if you don't have nothing nice to say, don't say it at all. Well, here you guys kind of speak it. So I had to get used to that. So it's a blessing and an honor to be able to talk to you guys tonight, and I want to tell you a little bit about veteran services. Ironically, when I moved out here, I had custody of 2 kids. One was 14 at the time, and the other one was 8. And I looked up after being here 6 months, and I found myself almost homeless as a veteran. So I went down to AutoZone on Park Avenue. I was working on my truck, so don't tell anybody I know how to fix vehicles, but I got a degree for a reason. So I was going to get some brakes from AutoZone, and lo and behold, a guy saw my scheduler that I'm always carrying around. He said, you a Marine? I said, yeah. He said, go down and meet with the local VSO. Well, coming from the Midwest, I had no idea what a VSO was, which is a Veteran Service Officer. I ignored the guy. About a week later, I was back in the AutoZone getting more parts, ran into the same guy. He said, did you ever go down to the Veteran Service Office? And I was like, well, maybe I need to go down and meet with these people. So I literally showed up in the Veteran Service Office. They took my application and they gave me this check. And I think it was roughly between $1,800 and $2,000. And I was looking for work at the time and custody of 2 kids. And I was saying to myself, this is awfully nice of these strangers to help me out just because I'm a veteran. I left. 30 days later, they called me and said, Mr. Robinson, are you coming to pick up your check? I was like, what are you talking about? And so I found out that that office literally helps veterans until they find work or help them find whatever services they need to get back on their feet. And then how ironic is it? 7 years later, I'm the director over that same office.
Wow.
So I went full circle. I literally went full circle from being homeless with 2 kids to literally running the office that literally helped me out. So I like to tell all my colleagues around the state and every veteran that comes in front of me, I lived it. I went through these services. I know what they're like. And now I'm on the other side helping make policies for veterans. And I'm sitting on the governor's board to end homelessness for veterans. All these things because I actually lived it. So to me, it's a passion to help out a veteran. I like to tell a lot of the veterans that sit in front of me, everything you're going through is temporary. It's like being in a corner, but you can't see around that corner. You just gotta trust the process. Ironically, I seen a homeless veteran about 3 weeks ago. He let me know that he was a veteran. I helped him out, told him, come to my office, gave him my business card. He didn't believe I was the director of Veteran Services. So he finally showed up 2 days later, and we literally got that veteran some assistance. He literally told me, he said, you know, I've been going to veteran offices for over 20 years. Nobody has literally helped me. And all he had to do was stop by our office, get educated on the services that were available to veterans. And come to find out, he's gonna draw a monthly check from us. We're gonna have him working with housing, with Worcester Housing, to try and find housing for the veteran. And ironically, the guy used to drive for Aerosmith. You know, I was so blown away when he was telling me his story, that he was a driver for 20 years for Aerosmith. And now he's a homeless veteran. You know, so everybody has a story. So I challenge my staff and all my colleagues across the Commonwealth to not look at individuals like a number. Everyone has a story. We don't know what they're going through. We don't know how they got there. That veteran said, Doc, I used to own 5 houses. I don't understand how I became homeless. You know? And then after further dialogue with him, found out his wife passed away with cancer. She paid all the bills and controlled everything. He didn't know what was going on. And he didn't know how to handle the responsibility after his wife passed away. So literally, we just got him some help and put him on the right track of going forward. So it's stories like that. So when you see a veteran across the city, you don't know their story. You don't know what they've been through. You know, I also got told when I moved out here, you're never going to get a job because you got long hair. You know, and I tell people, and I'll share it with you guys. I share it with a lot of folks. I often get asked, how do a retired Marine, get long hair? You know, I normally wear a high and tight like everybody else. I did for 20-some years. My youngest 2 kids don't understand. Like, Dad, they look at my picture and like, you got a bald head, you got, you know, this and that. But ironically, when a veteran is sitting across from me and they're telling me their story, that they're dealing with whatever ailment, whether it's a divorce or a death or drugs or alcohol, whatever their ailment is, I tell them everybody has a story. Everybody has been through something. The question is what are you going to do when you're going through it? You know, so I challenge them to say, what are you going to do? And they're like, well, what do you mean? So then I'll point at my hair, and I said, this is what I did. And they're like, what are you talking about? So September 13th, 99, I had a 3-year-old daughter kidnapped and murdered in Iowa. My 3-year-old had long hair, so I started letting my hair grow. My family thought I was going crazy, you know, but I knew it was a remembrance of my daughter. I carry her dog tag in my pocket everywhere I go. So when I complete something, I complete a degree, do something, she's there with me at all times. So I wanted to share that story with you guys to give you the motivation to understand it's not what happens to you, it's how you get up after that happens. What are you going to do with it? You know? So let me tell you a little bit more about veteran services since I've been speaking about myself here. Veteran services, we offer housing assistance, we offer fuel assistance, we offer clothing assistance. If it's something we can't do in our office, we will find an entity that can do it for a veteran. We're a part of what's called the Central Mass Coalition. It's made up of about 80 organizations. And we all come together, we meet quarterly, and I don't care if a veteran that's incapacitated, can't walk, needs yard mowed, we put it into the coalition, somebody goes mow the lawn. If a veteran needs a hospital bed, or a veteran needs a ramp put in, we put it out to the coalition, somebody takes care of it. So I was so impressed by that coalition, I was introduced my first week out here in Mass to this coalition by a gentleman by the name of Bill Ryan, who actually is retiring next Monday. He started this coalition 35 years ago, right here in Worcester. And it's about 60 to 80 organizations across Central Mass. We all come together to help our veterans. So in our office, the way it works, if you see a veteran, most veterans that have served a considerable amount of time, they know that they're a veteran. But you have some that question, well, you know, I've been told by another agency that I'm not a veteran. What I like to tell people is don't ask if they're a veteran, ask if they ever served in the military. If they say yes, don't even try and deal with them, send them to our office. We're in room 101 in City Hall, send them our way. Let us figure out how we can assist you. Our governor just signed what was called the HERO Act in August. The HERO Act actually opened up services for veterans that traditionally would not qualify for services. Now they can get some assistance. If they sign on the dotted line, they can get some help. Financial help or some type of assistance. So there's something out there for every veteran. But most of the time, you're going to find out that a lot of the veterans, like I was when I got out of the Marine Corps, they're stubborn. They went through the service. They believe they can do everything. They believe they can do it on their own. They can pull themselves up. And then when you tell them about these services, a lot of them say, well, you know what? I don't need these services. I'm like, you're homeless. You need this help. You need these services. And some of them still turn it down. And it's not until you get to know them personally, or literally I share my story with them to convince them to utilize these services. You're entitled to them. Let these services help you get back to who you are. Because everything you're going through right now is only temporary. So, in our office, if you come across a veteran, send them to City Hall, room 101. My staff will certainly take an application from them. If they don't qualify, we work with the local VA, we work with every local veterans organization. Some of the things that we have planned, since I took over the office about 18, 19 months ago, we wanted to make it more of a presence to do more outreach in the community. So hence why I'm here tonight. And some of you probably see me on TV or in the newspaper or somewhere. I made it my point when I took over the office to do more outreach in the community, let folks know that these services are available to veterans, and certainly send them our way. Anyone want to take a guess how many veterans are in the city of Worcester? Roughly? 10,000? Very close. We have just over 9,500 veterans in the city of Worcester. That 9,500, right now we're serving out of my office less than 0.001%.
Wow. Do they not know about your office, or how does that?
Most of that 9,000 won't qualify because they're financially stable. So that skews it some. But those, you can best believe, there's more than 120 that need these services. You know, so our cases fluctuate from 120 to 200. It's my goal, I want us to reach at least 3%. 3% over the next 6 months. You know, it's a lofty goal. If we get to 3%, we'll have roughly open around 600 cases. We've never had 600 cases out of that office ever in the 300-year history of the city. I think the most cases we've ever had was right after World War I in that office, and that was like 300 cases. So, but with the numbers that's here, 9,000, you best believe if we continue to do marketing, let them know these services are available, you best believe there's going to be more than 120 that qualify for these services, but they just don't know it, you know. So one of the other goals that we're trying to do is we're working with the city. We got great support from our city manager, our mayor, as well as the city council and various other departments. we're working and trying to not only market and inform veterans that these services are available, but I would like to see some type of veteran housing come here to Worcester. We used to have veteran housing years ago. We don't have it anymore. And I would like to, what's happening is when we see a homeless veteran, to permanently house those veterans, we're sending them out right now to Leeds, to Boston, and I want to keep those veterans in our city. Of those 9,000 economically, how much do you guys think they bring to the economy, to the local economy? Any guesses? Those 9,000 every year contribute over $167 million to our local economy. $167 million annually. So a lot of money keeping our veterans right here in our community where they can help out. So our office, like I said, we have an array of different things that are available. If a veteran comes in, they're behind on their rent, we like to work with all the local agencies, whether it's the RAF program or Worcester Housing, et cetera, but we also can fund past due rents also out of our office. We can fix autos once a year out of our office for a veteran that's in need. If they're looking for work, their car breaks down, we can actually repair that vehicle. So there are tons of things that veterans just are not aware of that our office can do for them. Just yesterday, I get a call quite often about a veteran unclaimed and morgue, left behind. I just buried a veteran yesterday up in Winchton, left behind. And I put a call out to the coalition and said, I have a veteran that we're going to be paying services for, work with a local funeral home. And when I got to the funeral, I was surprised that over 50 people showed up. None of us knew the veteran. And we gave him a great home for him. And I just thought it was so awesome. I started tearing up and I was like, this is what it's about. No one deserves, especially those that serve this country, to be left behind. And so we gave him a great burial yesterday. He was buried up in Winchton. And it just, blew my mind that this gentleman who actually served in Vietnam, and he was in, and he served in Persian Gulf. So he was in a lengthy time period. And no family to help him for his services. So we get those type of calls often. So I would encourage each of you, we have this book here in our office. It literally tells you it's free. You can stop by our office if you want to know more about veteran services. You see a veteran, tell them to stop by our office, get this book. It talks about every state program that the state office. Believe it or not, Worcester actually, as far as tax abatements, exemptions, we're further ahead than every city in the Commonwealth. The law states we should be given 400 on exemptions. We give 800. We double it. So we actually do a great job helping veterans out in the city of Worcester. I got any questions? Sure.
So I'm glad to hear the state is funding you. Is the cutbacks in federal veterans services going to affect your office in the future?
Not directly. Could be indirectly, because we're not the VA. The biggest misconception we have, people walk through the door, they believe we're the VA. We're not the VA.
Oh, good.
We are funded by you guys, and the state pays 75% of whatever we expenditure for every veteran, and then the city of Worcester picks up the other 25%. So we're not directly affected by what happens at the federal level. Any other questions? Yes?
Yeah, for those veterans who are financially stable, are there some benefits they're entitled to that maybe they don't know about?
Yes. Not out of our office, but we will put them in contact with organizations where there may be some services available to them. Hence the reason why I want them to stop by and get this book. This book has every service that's available to veterans across the Commonwealth. Okay. And so for those veterans that are financially stable, they may be entitled to exemptions for their homes, depending if they have a disability rating. For the first time also in quite some time, my office, we just got certified to file VA claims. So that's one way we are going to be affected indirectly by the federal government. Right now, if you go to, someone walks through any of the 6 individuals throughout the city that help with VA claims, right now it's like a 4 to 6 month waiting process just to see someone. So we got our office certified so we can try and relieve some of that burden. for individuals coming through. If you know anybody in the military or going in the military, I will tell you, tell them to get a copy of their medical records before they leave the service. Get a copy of their service record book before they leave the service. Because it's kind of tough to get them after you get out. You can get them, but it's best to get a copy of them while you're on active duty, and make sure you have that copy when you get off active duty. Just in case you need to file a claim. Believe it or not, if you get, say you come in and file a disability claim and you get 0%, which means you won't get a monthly check from the VA for whatever happened to you on active duty, but guess what you do get? You will get insurance paid for. So that's a savings if you're working. You don't have to pay that $400, $800, or $1,200 a month out of your check. So it's a lot of things that veterans are just not aware of, that are services available to them. So if they get a 0%, they can go to the VA and see the doctor. Another misconception is if you serve your time and you get out of the military, everyone has access to the VA for health insurance. That's not true. If you served, retired over 20 years, you're entitled to those benefits. If you had some type of ailment or got hurt or were able to claim a disability claim, then that opens you up to help from the local VA. So not every veteran that serves can go see the VA. Okay. So if you go in, you serve your time, nothing happens to you, you're good to go, you come out, you can get things like your homeowner certification certificate, which I used mine a few years ago. We don't have to put any money down in the house, which is good. So there's a lot of little things for veterans, benefits that we can get and we can utilize. Whether it's a GI Bill or go back to school. The actual military actually paid for my bachelor's degree and my master's degree. Now I tried to get them to pay for the doctor, but they won't go ahead. So, it really is a blessing. One of the things also, one of my goals is I'm pushing for, I would love to see a military appreciation day in Worcester Public Schools. And the reason being is, not every kid is going to college. Not every kid is going to college. So if they don't get a job or go to college, what are they going to do? You know, some of them are going to make bad decisions, find themselves locked up or something. So I would love to get a military appreciation day in Worcester Public Schools to help some of these kids understand the military is actually a great job. It'll build your resume. Not everybody that goes in the military goes to war, by the way. Not everybody. You know, that's another stigma. Not everybody goes to war. It depends on the job that you go in for. I literally got up in the morning, went to the office. Well, let me rewind that. When they say Marines do more, by 8 in the morning, we really do. We would get up at 3 in the morning, run 15 to 20 miles, and then I would be showered and go to the office. So that was my day in the Marine Corps. I'd be in the office all day, and then I would get off work and go home. So it was literally just a job, just like a job, and you're gaining all that experience. And by the way, I used to hate talking in front of people. 7th grade, short story. I got an F in science class. And I go home and my mom sees my grade. She said, "What did you do?" And I'm like, "Mom, I swear I'm doing B work, A, B work." So we went and talked with the teacher the next day, Mr. Wilcox. And he said, "Miss Robinson, Joe just won't say a word in class. He won't talk. But he's doing great work." And my mom looked at me and said, "Oh, he's going to be talking tomorrow." Since then, I haven't shut up talking. So I've been talking since she corrected me that day in 7th grade. And another short story is when I went in the Marine Corps, and they truly do build leaders in the military. I walked in after my first year, and they told me I was going to teach a class. I forget what it was over, so I was assuming it was going to be something like this. And when I walked into the room, I come around the corner, and I was like, "You got to be kidding me." It was literally an entire battalion, about 600 Marines. And I had to step on this podium that was high as this table, and my face was on huge TV screens all around. And that was my first experience teaching, so you can kind of understand that scared me straight to where I'm not scared to talk. So military, you learn a lot of good traits in the military. You get to do things that you never get the experience in life, like jump out of helicopters and do all those things and play war games. What kids do now on Call of Duty and all that stuff, we get to do it in real life. So I love that experience. So you got the experiencing that you normally wouldn't get to do. Yes?
Yeah, when you started up, you said that you went out to get a pathway of vehicle, and then somebody told you that there were there's a service, but VSO let's say we can't go there, they can give you some help.
Yeah.
And you didn't go there. And also along the way, you said that there are some servicemen or service people who do not know, who are not aware of the services you provide.
Yes.
Is there any outreach service that you are giving to the people who are not aware, get to know the services?
Great question. Yes, as I stated, since I didn't know these things existed, I literally had been in the city 6.5 years before I took over this job. And then I found out that, hey, we got a water event the day before Memorial Day. Then we got 3 Memorial Day events for veterans. I lived there 6.5 years and didn't know those events existed. So as I said, a lot of the decisions I made, because I actually lived them. So one of the things for the first time this year, we're investing a lot of money into marketing and advertising and actually doing outreach to the veterans. So now we just created, or we got in the works of being created right now, something simple as postcards going out to all 9,000 veterans, letting them know the services we have. We want to send the veterans a birthday card on their birthday, let them know that we're here. We got a lot of things that we're going to be implementing. I'm going to be doing, hopefully me and Judy will be doing some type of show here pretty soon. She's running the camera there and cable services. Hopefully we'll be doing a weekly or bi-weekly veteran show, inviting some local veterans on to tell their stories, their experience, also talking about some of the history. Me and the mayor went out and we did, I got a call from a veteran who was turning 100 years old on January 31st. So we went out, his son called me 2 days before his birthday and said, Doc, is there something you can do for my dad? He's turning 100 years old. He literally fought in the Battle of the Bulge. And I was like, are you kidding me? That's like history books to me. I'm like, there's no way. So me and the mayor, I called the mayor up. He was so nice. He said, yes, Doc, we'll go do it. They made a key to the city. We showed up at the gentleman's house. And we walked in, and he saw the mayor, and he just started crying. He didn't know why we were there. And his great-great-grandkids was there. His children were there. And he stood up, greeted us, and we awarded him a key to the city. So it's little things like that we can do to let our veterans know that we are available when we're here. And we gave that gentleman a key to the city. To answer your question, yeah, we're starting a real aggressive marketing campaign right now, reaching out to the veterans, not only the veterans, we want to reach out to all the churches in the city, regardless of denomination. They have veterans that attend those church services. So we're going to try a different approach of reaching individuals versus just providing the services and not telling people they were actually here. So we are. Yes?
Quick question.
Sure.
With your outreach efforts, and given that you're the Veterans Service Office of Worcester, are you also in partnership with Veterans Affairs? Because a lot more people obviously know of Veterans Affairs and often face a lot of roadblocks trying to get services. So are you in partnership with them to reach the veterans that you say you want to reach?
Yes, we are. When she said Veterans Affairs, which is the Veterans Administrations, yeah, we work with them almost daily, from everything from housing to to whatever medical services that they provide. So when a veteran comes to our office, we not only tell them about the services we provide, we tell them about all the local services. And in fact, we're going to be launching our first veterans newsletter that's going to be going out and available in the month of April here, coming up. We're going to be launching our first newsletter. So we're going to be allowing local veteran organizations. Right now, every veterans organization in the city, they kind of do their own thing. You know, they do their own thing, and then it's hard to get everybody in the room because everybody has their own agenda and so forth. The unique position that we're in as the city, we can bring everybody together and say, look, this is our main focus, which is serving veterans. And so that's one of the things we're trying to do, is just bring everybody to the table, whatever you're doing, and just let the city know that these services are available. And we also refer veterans out to every veteran organization that's locally that come through our door. Yes?
Are your services, are the both services not overlapping in some areas?
Are they overlapping?
Yeah.
Some of them are. Some of them are. So for example, if a veteran comes in for housing, say they're behind in their rent 3 months, and they come apply for assistance, rental assistance through us, and they qualify, we send them to Veterans Inc., a local, or Project Newell, or the RAF program. We send them there, or we send them to the VA for services. And we check with those entities to see if they already have a case open, so the veteran is not double dipping and getting money from us and then also getting money from this other organization. and getting the rent paid 3 and 4 times. So, yeah, we certainly look out for that.
We have time for one more question.
Okay.
Thank you, Dr. Robinson.
You want, yeah, here.
Yeah, I was wondering if you could talk a little bit about, so you were just saying when you're in the military or whatever branch, I don't know, right?
Marines.
Marines, you get all these skills, right? But then it
Yes.
seems like when folks leave, we're ending up with a high rate of homeless veterans. Like, how is that, like, what's happening there that's occurring?
Great question. Her question was, how is this occurring and we have this high homeless rate of veterans when they go in and they get all these great skills? Well, those that haven't served don't know there's a difference. And even companies don't understand there's a different level of veterans. A veteran that went in for one day and got kicked out is not the same as somebody like me that served over 9 years. So the longer you serve in, the longer you grew to utilize, professionalism, accountability, and those skills. But when a veteran puts their resume in front of you and they have veteran on it, you don't know how long they served. So we just say give them all a chance. Just because they got out after one day doesn't mean they don't deserve the opportunity. But there are different levels than what we see. So most of the homeless that we see are not the veterans that serve. You might have a few that you would see that served over a year or 2 or 3 years or 4 years that find themselves in that situation like I did. But the majority of them are veterans that, served a day or two or served 30 days and got out of the service for whatever the reason was. But just because they served, whether it was a day or 30 days, they still deserve the same honor because you know what? They decided to put it on the line for the country, regardless of how long they served. Okay? Well, thank you guys for your time. I really enjoyed it.
Thank you so much.
Thank you so much to Dr. Robinson. He is truly a ray of sunshine.
Actually, 15 years ago, first time we had the Civic Academy, and thank you for being part of this effort to bring it back to life, and we hope that you'll go forward after these 5 sessions and spread the word to people in your communities and let them know about the Academy, because I know it's something the mayor is committed to continue to move forward. So we hope you are enjoying with the program. I want to thank the mayor's remarkable staff for the great job they're doing. And I just have to say that I like to say that Worcester is an incredible city with a rich history and a bright future. It is. I love this city because it is one of the most livable cities in this country. And part of the reason is we have great leadership in our city council and city manager and others, but also we have a remarkable group of public leaders like the next one you're going to hear from, who have dedicated their lives to making life better for people here in the city. Rob Antonelli, who's going to come up now and talk about the Parks Department, has been with the Parks Department and Department of Parks and Public Works, to get it right, for 27 years, is that right? And does a remarkable job overseeing the incredible parks and playgrounds that are around our city. So without further ado, let's get up to give a warm welcome to an incredible public servant, Rob Antonelli. Thanks, Rob.
Well, how's everybody tonight? They saved the best for last. So, again, my name's Rob Antonelli. I'm the Assistant Commissioner. I manage the Parks, Recreation, and Cemetery Division for Public Works. We also have on that the golf course and capital projects. So any park capital project that you may see that's going on out there is also managed by my office on that end of it. Let's see here. So, short list. I told my staff to help me sort of put it into one page. There's probably 3 or 4 more pages beyond this that we do. So what we like to say is we go cradle to grave between the cemetery and our youth programs and all of the events that we do throughout our public parks. And that we also look to make quality of life an important component within the city of Worcester. So not only do we touch on parks, anybody know how many? 62. With 62 parks, 1,400 acres, We also do it with our public shade trees as part of the urban forest. We also do it as part of Hope Cemetery, which is 160 acres. We also do it with an 18-hole municipal golf course, Green Hill Municipal in Green Hill Park. And so we're really looking in multiple ways to try to bridge many of the gaps and give our community, right, the best that we can give them. One of the things that we enjoy the most, well, for me, is, sorry, I got sidetracked there. One of the things that I enjoy the most is being able to drive by a public park and see that park being used. So for me, right, you're driving down the road, all of the work that we do on a daily basis, and you drive by and there's a playground there, and that playground is full of kids, and they're yelling and screaming and they're running around, right? That for me is probably the most enjoyable component of what we do, right? Because that's really what we're about. What we found in COVID was that we were the only outlet, right? We were the only place that many residents could go. We were the place that residents in other communities came to because we had such a wide variety of availability. And lucky for us, lucky for all of us, that our mayor, our city council, and at least the last two, but those before them, city managers, Ed Augustus and Eric Batista, have made parks and priority in the funding component, in our improvement component, in all that we try to do, right? So we're always trying to better our facilities. When we look to better those facilities, what are we looking to do? We're looking to give everybody a different perspective on what parks are about. So we've built a spray park. We're building a spray park currently at Tacoma Park and University. We just finished a skate park down at Crompton Park. We're building a brand new community garden facility up in Green Hill Park, where we've expanded the number of beds from 15 to 65, I think it is. And so those are the kinds of things that we're looking to do. Those are the improvements. But a key component to those improvements are also the fact that, right, my staff doesn't get much larger. So to give you a little bit of understanding, back in 2004, the same division, same group that I work with right now, was 72 employees, right? So that included parks, recreation, cemetery, forestry, and Green Hill Golf Course. Today, we are at 67. We lost a third of our staff during the downturn in the economy between 2004 and 2010. But we've been able to make a lot of that back, right, by thinking through smart designs, looking to minimize our maintenance functions, and to sort of look at new technology that's out there that helps us do our job better. One of the things, and we talk about this a lot on our staff side, is one of the areas that we really focus in on is a lot of the handwork. So if anybody's ever has a yard or has done yard work or done anything along those lines, right? What takes you the most time, in most cases, is the handwork, is the trimming, is the weed removal. It's the small stuff, right? That's what takes you the most amount of time. What we've realized is that if we can eliminate as much of that as possible, and I can keep staff on 12, 8, 16-foot mowers with big wings that come down, right? I can get a lot more done in a facility doing it that way than I can where I got to go and trim every single fence line, along every single guardrail, along every single parking lot. And so we're trying to think better and think more about maintenance when we build something than let's just build it and then we'll figure it out later. So we're really thinking about a lot of that stuff ahead of time. One of the newest things that we have in our operation is a brand new, thank you to the City Council and the Mayor, Urban Forestry Master Plan. We've never had one before. We've had internal documents, but nothing ever fully blessed, fully gone through a full review by both the council and by the public to sort of guide us into the next generations of urban trees. So if anybody knows, back in the 50s, there was a tornado that came ripping through Worcester, knocked down a lot of trees, damaged a lot of property. After that was done, what the city decided to do was plant a single species, or more so single species tree, which were mostly maple and mostly Norway maple. Well, what did that do? So yeah, it worked great, right? Trees grew up. We had Norway maples are technically more of a weed tree, more of a quick growth. I mean, they're nice, they're great, but they knew that that would bring the canopy back somewhat quicker than what other species would be there. But what happened was that when we came into 2008, and I'm sitting in a room with the federal government and the state government, and they're telling me, oh, guess what? We're gonna have to take down 20, 25,000 trees. I said, no, you're not. We're not doing that. ALB came in and wiped us out. So you go through the communities up near the Summit, up off of Burncoat Street, up off of West Boylston. You go up that whole neighborhood. I mean, that place was devastated. So what we've learned from that, and what we've now learned, and what we're doing now, is making it so that we're more diverse. We have more species. We have a lot more diversification. We've gone from our previous high of almost 69% maple tree in the city of Worcester to our current number is about 29%. So now, right, we all got to look at the benefits of certain things that end up happening to us. And I wouldn't say ALB was a benefit, but I think in the long term, we're going to see it and look back and say, all right, well, yeah, it was really bad going through it, but we were really able to diversify our species within our streets, diversify our neighborhoods, be able to not have that monoculture that attracts a single pest that's going to take out, thousands and thousands of trees. And this master plan really helps us, guides the city, guides us where we're trying to go, guides us with what we're looking to do and how to make it best for everybody. One of the things that I focus on with all of my staff that I work with is that my goal is to make it better for the next person, right? I'm not going to be here forever. As Joe said, I'm in my 27th year as of right now, as of April 21st. And, right, there's going to be someone after me, right? And I don't want them to have to deal with they're still going to deal with some of the issues I deal with now. But if I can minimize some of those issues, if I can minimize some of the crazy things that we ended up doing just to try to get things done and do it so that it's systematic, it's correct, it's for the long term, it's a much better system for those who come after us. And we're using your taxpayer money and my taxpayer money, since I live here as well, we're using that more appropriately, right? We're using it to a point where we're really gonna get a value for the city as a whole. Couple other areas, Hope Cemetery, again, 160 acres. We do everything from burials to monument installations, we dig the hole, we do all of that stuff that nobody wants to talk about, and I understand that. We talk about it every day, but you sort of, when you live that life, that's what we do. But what a great facility to just walk through. So Hope Cemetery is one of the first of the sort of the park concept cemeteries, where there were a lot of trees, there were areas to walk, and it was more built out as a park cemetery. So they sort of took sort of the park theme and made it and put it in a cemetery. Great facility, rolling hills, some flat areas. We just opened up 3 years ago our first dedicated Muslim area. So all of our graves face Mecca. They're a little bit wider, and we built it in cooperations with the Islamic Society to make sure that we were fitting what their religious needs are. But we've done the same thing with a lot of our other religious groups. Greek Orthodox, Christians, you name them, we're always working with them to try to figure out how best we, as a non-denominational cemetery, really can serve the entire population. We are also the main location for all of those individuals that don't have family, don't have enough money to be able to be buried appropriately, right? So we're also the home of those individuals as well. So we work with the Commonwealth, and there's most of the funeral homes have a program where they work with the Commonwealth, and the Commonwealth gives them X amount of dollars. We discount our rates for that as well, as long as they're city residents, and we do that as well. So really, Hope Cemetery is really, if you ever want to go there, you would really never even know you're in the middle of a city. I know 290 is like right there, but if you're up into it a little bit, great location just to be able to walk around, look at some of the headstones, look at the stuff that's from the 1800s. We have a whole burial section. If you're ever interested to come in through the main gates on Webster Street, take your first right. There's a whole section there of graves that we actually moved from Worcester Common when they were building out front, which is now, I'm sorry, I've been here long enough, so it was Front Street, now it's Church Street. So that section there, when they were building that out and doing some of the work in and around Worcester Common, they took those bodies from that area and moved them to Hope Cemetery. We're just finishing up a program with our Friends of Hope Cemetery. And what we're doing is we're taking the gravestones that were laying flat. They were buried, laying flat. And what we're doing now is we're taking them, we're bringing them out, cleaning them out, and then putting them in the approximate location of where they were found. And so it's just fabulous to be able to look at all of that information, what's there, and just sort of see the breadth of what Worcester really is. Some of the most famous people are buried in Hope Cemetery. Great place to walk around and take a look at. I would say to you, go to the Friends of Hope Cemetery website. They have a lot of good information there. You can also get it from the city's website as well. One of the other areas that we do work on, and if you drive through our 62 parks, 1,400 acres, you'll see we have a large number of public buildings, many of which are seasonal buildings. We do all of the maintenance and all the repair of all those as well. We cooperate with Youth Opportunities and other agencies to do our summer recreation program. We manage one pool. So at one point, anybody that's been here long enough, we had 9. They technically weren't pools. They were more like wading pools on steroids. You know, they were only 3 feet to 3.5 feet, but they were a place for people to cool off. We've sort of transitioned more to a spray park function there, but what we've really worked to do now is we have the YMCA, who we've brought under contract to do our lifeguarding at our public facilities, and really look towards them to help us get both lifeguards and then also be able to do the swim lesson component to it, right? Because swim lessons are a functionality that not a lot of communities do well unless you're down south where you have pools that are open for a much longer time period, or people have the money to be able to go and learn. So a lot of what we're doing is sort of education, and in some cases, because kids will come in and come out, right? A lot of it is just education, just small pieces like swim with a buddy, do this, like just those small little things that can save a life. Because we've had drownings, I never want to go through it again, but you know, the more we can do on that, and the more our working relationship with the why, the better off we are across the board. So the other thing that we do, second to last item on this screen here, is that we set up all of the elections throughout the entire city of Worcester for each election. So presidential, for municipal, for state, whether it's a primary or the main election, we are the ones in our division that go around for working collectively with the city clerk's office and elections to go in and physically set up all of the booths, bring all the tables, do all of that work, and then break it all back down and then put it back in storage. So, you know, people say, well, why do you do it? Well, years ago when we had, 80, 90 people and it was November, right? You were looking for things for people to do. Now that we have 30 in parks, because when you break out all the other divisions, it just stayed with us because I tell everybody just because we do such a great job at it. But it's a lot of work, particularly during an election year where you have a presidential, you have a state primary, and then you have a regular election day. There's a lot of work that's involved in it, a lot of work in cooperation to try to get all that done. One of the areas that we've really started focusing on our end are athletic fields. So if you haven't played sports, it may not be like, well, why are you putting so much emphasis on that? Well, athletic fields are a location where you get a lot of teamwork, a lot of interaction between both youth and adults. You get a lot of sportsmanship. And one of the things about sports fields is that, they can be dangerous sometimes if you don't maintain them the correct way. And so we've really started putting an emphasis on our sports fields, particularly our grass sports fields, to make sure that they're meeting certain requirements for our youth leagues and our high school leagues that say, you know what, when you go out there, you're going to be playing on a quality field. The other thing we want to do is that because Worcester brings in a lot of the communities around us, we're trying to make them all jealous. And so that's one of the areas that we've really started focusing in on the athletic field side, because we found that by doing this, it raises, when you drive by a sports field and it looks like it's like, wow, right? It's energy that drives up the importance of what parks are. It makes the players that are there feel important. It makes it safer for them. It makes it more enjoyable for them because it's more consistent of a playing field. And so those kinds of things we're trying to really focus in on. And as it says here, we have 3 synthetic turf fields. Those are located Farber Field off of Moreland Street, Glotus Field, which is off of Providence Street, and O'Connell Field, which is on Grove Street next to the fire station. So those 3 facilities. And then we have 68 other sports turf facilities. So always trying to work, always partnering with our youth leagues to help maintain them, to keep them in a condition that's appropriate. 2 other areas I just want to highlight quick on that is Green Hill Golf Course. Green Hill Golf Course was initially opened in 1929. Before that, the city of Worcester had a golf course down where Country Club Boulevard is now, down off of Lincoln Street. They ran it, they leased it for a particular short period of time, and then realized that the game of golf was something that they wanted to get into. And we'll be celebrating our 100th year coming in 2029. So we're really excited about that. We've continued to do some work there. our numbers and our the amount of money that we're both putting into it and getting out of it have risen over the last 5 years. COVID was really helpful because it was like the only sport you could do and still stay distanced from everybody. So we've really come into that. There's been a number of golf courses in the area that have also folded. Leicester Country Club out in Leicester just folded. There's been a couple other ones that have folded over the last 10 years or so. But what a wonderful site. If you haven't been there, I encourage you to go there. If you don't play golf, I understand. But we have a great restaurant that's there. We have a beautiful deck that you can go sit on, and you can sit back and enjoy, watch a sunset, just look over Green Hill Pond. You can see the Vietnam Veterans Memorial on the other side of the lake. It's just a fabulous location to be able to enjoy a nice dinner out and just have a nice evening. So I would encourage all of you to, if you have that chance, to do that. The other one that we have is Green Hill Farm. Green Hill Farm is a small little farm that we have in Green Hill Park. We have small little horses, llamas, alpaca, sheep, peacocks, some other fowl. Usually we have a bunch of pigs there as well. And so really it's we have a farm cat. So we have a farm cat, helps with the mice. But really a good location to bring if you have little ones, anyone that doesn't know or maybe hasn't seen that or hasn't had that opportunity. So great location to be able to go. We're open 6 days a week. We're only closed on Mondays. Usually, I think it's 10 in the morning till 2:15-ish in the afternoon, but we're open Saturday and Sundays. Great location. Again, that's on our website. Feel free to look that up there too. But a great location to be able to enjoy. We've been putting a lot of work into there to try to both expand that location as well as give some different opportunities. We're actually going to be launching in May, we hope, a program where we're going to have an event every month there that's going to, and I can't tell you the events yet because we haven't finalized them, but we're going to be looking to have these events every month to try to get people there to the farm, to Green Hill Park, to be able to enjoy the facilities that we have. The other couple of things that we do, so I also am the staff liaison to 3 commissions, 3 volunteer commissions: Parks and Recreation, Hope Cemetery, and Urban Forestry. And then Dr. Robinson, I help support Dr. Robinson on a 4th one, which is Monuments and Memorials. So what you see here is the Vietnam Veterans Memorial. The one in the middle is the World War II Memorial on Worcester Common, and the bottom one is the World War I Memorial in Green Hill Park. Just so everybody knows, the Vietnam Memorial, it's not Worcester's memorial. It's the entire Commonwealth of Massachusetts memorial. So we built it in 2004, 2002, sorry. And it has always been the Commonwealth's memorial. We've had challenges with the Commonwealth supporting the memorial in some years, but I will tell you, between Dr. Robinson now and the veterans that I work with day in and day out to maintain that facility, they are beyond unbelievable on how they go after and they want to make sure that funding is available for us to be able to take that. And even in the years when we were getting cut, that facility was one of those facilities that, I said to my staff, we're not gonna let it overgrow. We're not gonna let the weeds go in. We're gonna keep continuing to do what we're doing because that's how important it is. And so there's 3 areas there. There's the place of flags. There's the place of names. So it lists every single Massachusetts resident that passed away as part of the Vietnam War. And to be qualified for that, you need to be on the federal wall. And then there's the place of words. That is where you can read a whole bunch of different letters that families, that some of the service individuals sent home. Some of them died before the letter got to their families. Very moving, very, just really awe-inspiring. And it's a nice location, it's quiet, great location. So I'll take any questions if you have any. Oh, one other thing, pickleball. So, pickleball is an excellent sport, but there are problems with pickleball when it comes to noise, right? So we are currently working between us and the mayor's office, as well as the city manager's office, on finding some locations where we can have dedicated pickleball courts. That has not happened yet, but we're getting close. But if you go to Brockton and Brookline and some of the other communities, there are lawsuits between neighbors and cities that are saying that the pickleball game is too loud, and all they hear is thump, 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 thump from morning till night. So, not that we haven't thought about it, but we are looking at that, trying to find the right location so that we can make sure that that doesn't happen to us. What other questions?
With the Friends of Weatherall Park last fall, we received a $4,000 grant and we planted with the Worcester Native Plant Initiative, and we have a challenge with watering. Is there anything you can do to help us with watering over the summer to make these native plants grow?
So we're going to have a problem with that no matter what right now. So two things. One, we're in a drought situation across the city of Worcester and throughout the Commonwealth. So watering is going to be a challenge, at least as I see it right now, unless we get a lot of rain coming up on that side of it. The other problem is I really don't have the resources to be able to send somebody out there to water. With our tree planting program, we're chasing 300, 400 trees in a given year, trying to do those, both under contract and others. But to try to do that is difficult, and to install a watering system there is another whole expense.
Okay, second question. As far as knotweed in the woodlands at Weatherall Park, do you have any type of city plans to address the knotweed issue?
So we do not as of right now. It is an item, so invasive species is an item that we're looking to build out. I have it as part of my budget request this year to see what we can start doing to try to address that particular situation. Other than that, no, not as of yet, but we are aware of it and we are working towards it.
Two questions. The Citizens of Color World War II Honor Roll Memorial, who runs that and who watches that and takes care of that one downtown?
So that would be Dr. Robinson. He would be the one that if there's an issue or a concern or whatever, you'd want to talk to Dr. Robinson on that. We are, under Parks, we're managing the reconstruction of the Lincoln Square Memorial right across the street. So we're doing that on our end of it, just because we were working on it long before Dr. Robinson started. So we've kept that, and I'm going to finish that. But all of the military monuments, all of those, all fall under Dr. Robinson now.
And last question. In regards to the swimming pools in Worcester, when I was growing up, we had swimming pools, and now there's none. I grew up in Maine South, right down in Crystal Park. There was a swimming pool. It's gone now. And earlier we were talking about Black and brown communities that lack resources. A lot of these kids can't afford to go to the beach, can't afford to have a car ride to go to a place where they can swim. They can't afford to go to the Y. So these little sporting parks are nice, but will you ever bring swimming pools back for people who can't afford to travel distances to get to some water?
So we've looked at bringing them back maybe in certain locations, but we will never get back to the 9 that we had previously, just for a couple of reasons. One, they're only open 8 weeks a year. I understand it's an important 8 weeks, but the cost, so Crompton Park Pool, when we built it, was $4 million. That number now is probably closer to $8 to $10 million to build that same facility today. That's number one. Number two, we're really trying to push some of the ponds and beaches that we have and really staff those facilities where we can also teach swim lessons. So we're offering swim lessons in all of those facilities as well on that end of it. And then we're trying to look at other partnerships where we can look to try to expand the swimming side of things. I get the fact that the spray parks aren't swimming pools, but at the same time, we're trying to balance all of those needs and trying to at least give everybody a place to be able to cool off.
If, with your permission, this is gonna be the last
Yeah, whatever.
question, and then we'll just close it out for everyone.
All right, y'all, so I'm gonna ask this as slow as possible so y'all can't go nowhere. No, I'm just joking. Rob, man, I gotta ask you. So, what is the biggest challenge around plowing?
In regards to what?
Plowing.
Plowing. So plowing is not me.
Gotcha.
I do snow removal on 18 miles of sidewalk, all of City Hall, and any park road. So like Green Hill Park and in and around some city buildings.
Gotcha.
I don't do the regular plow routes on that, so
Gotcha.
I apologize.
No problem.
All right. Well, thank you very much.